Invisalign is a revolutionary orthodontic technology designed to move your teeth without braces, without anyone even knowing that you have Invisalign in, and the results are great. We're going to talk about the results. And did I mention it's clear and people don't even know that you have it in? There you go. Let's go. Hi, I'm Dr. Robert Passamano. I'm a board-certified orthodontist, and today we're going to be talking about Invisalign. What is Invisalign? How does it work? And how you can be successful with Invisalign. I see great outcomes. I also see okay outcomes. And I also see teeth that don't even move. And today I want to talk about how you can be successful. What are the tips and tricks to get a great outcome? So in this photo that you're seeing right over here, on the left-hand side of the screen, we are seeing the initial position of the teeth. On the right-hand side of the screen, we are seeing a finished Invisalign smile. Before the year 2000, this type of treatment would only be successful with braces. And now we can treat these cases with Invisalign. Let's go over some basic Invisalign information. Invisalign is a series of clear aligner trays designed to move your teeth over time. Each tray is worn for about 20 to 22 hours a day. And you're gonna wear it for 5, 7, 10, or 14 days, depending on the velocity of tooth movement. The trays come in packages that look like this. You'll start on tray number 1, then you'll go to 2, 3, and so on. There's really no food restrictions with Invisalign, meaning you can pretty much eat whatever you want. However, there are some foods and drinks like coffee, turmeric, that can stain the Invisalign attachments, and we'll go over preventing stains with the Invisalign in just a minute. You remove the trays when you want to eat, brush, and floss. So, who is Invisalign designed for? Invisalign is designed for mild, moderate, and some difficult cases. The reason why I say some is because Invisalign isn't for everybody, but it can be served for most people. The ages that we use Invisalign are from 8 to 80, and it can be used with implants, bridges, and crowns. And there are limitations for difficult teeth, such as a lot of rotation or a lot of root movement. The first step to starting Invisalign is the digital teeth scan, which is a 3D image of your teeth. Using that 3D image of your teeth, we can simulate the outcome so you know what the teeth are going to look like before you get started. On the screen you're seeing on the bottom right is a digital image of what the teeth could possibly look like. This is the digital Invisalign simulation. On the screen you're seeing the teeth move over time. They go from initial position to the final position. This specific patient had 50 total trays to get to the outcome that you're seeing on the right-hand side of the screen. You're also seeing attachments, which I'm going to talk about in the next slide. So this is how the Invisalign works. Invisalign attachments are dental composites that are bonded onto the outside surface of the teeth that help with more difficult movements. Those difficult movements are usually extrusion, like up and down movements, difficult rotations, or root movement. What you're seeing on the screen is Invisalign attachments. So the middle ones without the trays, those are the attachments. They're translucent, so you can't really see them when the trays are out. But when the trays are in the mouth, then you could slightly see the attachments. You're going to see the shadow of the attachment on the edges. And so that is the Invisalign attachments. On the top right, you are seeing the digital simulation. So that's why it's pink. And then the photo below it, you're seeing the actual patient. And then on the photo below that, you're seeing the top-down view of what the attachments look like. So you do feel them. They're on the outside surfaces. They're like braces, but they're clear. And they're shapes that are designed just for that specific movement. One of the best ways to ensure successful Invisalign treatment is virtual at-home monitoring. Using your cell phone and a scope, you'll be able to send in video of your teeth to ensure the teeth are moving well and the trays are fitting exactly like they're planned. This also reduces the amount of in-office appointments because if there's an issue or there's a question, you send the video on over and then I take a look to make sure everything's going okay. Invisalign appointments in office are generally spaced out every 2 to 4 months. All right, here are my top 5 tips to ensuring successful Invisalign treatment. Number 1, this might seem obvious, but it is wear the trays 20 to 22 hours a day. I've seen patients wear them 18 hours a day. I've seen some go 20. I've seen some do 22. The 22-hour-a-day Invisalign patient is going to have a much more successful treatment than the 18-hour-a-day Invisalign patient. So I highly recommend wearing them as much as you can to ensure that everything is going according to plan. Number 2, use your phone calendar or the My Invisalign app to maintain your Invisalign tray schedule. You're busy, everyone's busy, I'm busy, keeping track of your trays, change them out every 5 days, every 7 days. It's difficult to remember. Use the phone app, make it easy, put it in your calendar, and that way you can ensure that you're on schedule with your appointments and also your teeth movement. Number 3, virtual at-home monitoring. This is an absolute must. This is so you can have direct communication with me or your doctor to make sure that your teeth are moving well, so that way you're not off track, you're not going in the wrong direction, that you're staying on track the whole way through. Number 4, this one's kind of an optional one, but I always find that patients that do the chewies 2 to 3 times a day get a better result. Not every doctor does the chewies, but what I find is patients that do the chewies get a better result. And the last thing, number 5, is preventing the stains with hydrogen peroxide based products. So that's gonna mean hydrogen peroxide based toothpaste, which is like Colgate Optic White, Arm & Hammer PeroxyCare, and also using the foam. That's gonna be the Ever Smile White Foam. They'll do a small little spray of the foam inside the tray. This is great for when you're on the go or at lunch. Invisalign is like art. Just because you have a canvas, paintbrush, and paint, it doesn't make you Picasso. Same thing with food. Just because you have the same ingredients doesn't make you Chef Gordon Ramsay. We pride ourselves on creating the exact same smile and bite with Invisalign as braces. It's a little bit harder to do that, but it can be done. And we've been recognized in doing so. We post a lot of our clinical results online. We've submitted to the Invisalign competition, and we've been recognized for getting amazing results. We have 9 national publications, 1 Teen Case of the Month, that's a global recognition, 2 Clinical Excellence Awards, 2,500 patients have been treated in our office. We get amazing results. I do run an Invisalign mentorship program for general dentists locally. A long time ago, we were doing Invisalign Facebook live stream with a mom blogger in Orange County. Let's go over some Invisalign cases so you can see what can be accomplished with Invisalign. This is a 9-month open bite treatment. As you can see, the patient had a 2mm open bite on the front 4 teeth, and so we extruded those teeth. They needed, of course, attachments on those front teeth for extrusion, and you can see this person has now normal overlap. Now they're able to eat and speak a little bit easier and better. And so this was a great case for a 9-month case. The next one is a 10-month case, and this one involves stain removal as well. This is a retreatment patient. So this patient already had braces, not with our office, a different office. Their teeth moved and now they want them straight again. So I do a little bit of polishing between the teeth to remove the teeth stains. And then of course, we're gonna finish with permanent upper and lower retainer wires. So that way this patient doesn't have to do orthodontic treatment for a 3rd time. This is what we call a normal bite but crowding case. This person just has rotations on all the teeth, and also a crossbite on the canine. So you can see the canines on the middle left image are on the wrong side, so we moved those forward, created a beautiful smile here. This one took about 15 months to accomplish, and this person, because the amount of crowding that they have on the bottom, we did the permanent upper and lower retainers, and that way the teeth stay straight for good. This is a teen patient where they had a crossbite on that premolar, as well as a deep bite and an overlap. This is also called like buck teeth. So this one involves rubber bands. So yes, can you use rubber bands with Invisalign? Yes, just the same as you do with braces. This is an amazing result. The same result that I would have gotten with braces, but we got it with Invisalign, and she was thrilled that she was able to accomplish this in the same amount of time with Invisalign rather than braces. This is a double incisor crossbite. This was actually the simulation that I showed you at the beginning. This took 22 months to bring those teeth forward, so they're no longer in crossbite. Got an amazing result here. This kid's thrilled with it, that he didn't have to have braces to accomplish an amazing smile. Can Invisalign expand arches? The answer is yes, they can expand arches just like braces. The patient had a very narrow arch, multiple crossbites in the back. We were able to expand, widen his arch, give him a great smile. And this is one of my favorite cases, actually. I think his bite looks great, teeth look great, smile looks amazing. So I'm just thrilled with the results. Thank you guys for watching the Invisalign Explained video. I hope you found the information beneficial. Hopefully you learned a little bit more about what Invisalign is, how it can move teeth, tips and tricks on how to ensure successful treatment. If you know someone that needs Invisalign or wants it, or you want it, reach out to me or another Invisalign doctor. And don't forget to like and subscribe the video below. Thank you guys and have a great day. All right, bye-bye.